So you heard from Jose and from Sergio this morning. I'm wondering, is there anything that you heard that was extraordinarily shocking or surprising to you? Anything that was presented this morning that was an aha for you, or that made you sort of step back and ask you? Yes?
The fact that there's so many high percentage in the retirement.
Okay, so that one you didn't know? Okay, baby boomers are retiring. Other? Yes?
There was an article in the Late Times this past year on the underrepresentation of Latino physicians in Los Angeles. And I talked to my partner Sarah about that, and I didn't know it was so bad.
So it
was like so bad. Like, this is Los Angeles, right? Many other Latino.
Very large Latino community, have needs, so where are the physicians? Yes.
I'd like to see it. Thank you so much for this is great. It's fantastic.
Absolutely. Yes.
It was just not even on my radar to think it's my responsibility to talk about food donations. But right now it's like, yeah, why don't I talk about that more often? Like, maybe only with advanced directives, and then I went through that. That's when it comes up.
And how much advanced directives were?
Yeah.
in physicians' doors that say, quote, "We do not accept Medi-Cal." Right? By the way, there's no requirement to accept Medi-Cal. We could talk a little bit more about that. So we did this little survey a while back, and what you can see here is the number of physicians that are accepting new patients. If you're privately insured, 80% of physicians will participate, and if you're covered under Medi-Cal, it drops to 62%. And of course, if you're uninsured, because remember we have about 3.5 million uninsured still in California, even less likely that a physician will see you. And then this is really important to note as well. Providers who participate in Medi-Cal vary by the type of practice they're in, and so if you look at the survey that Sergio went over this morning and that's in your packets, you notice that increasingly physicians are participating in medical groups, and a lot of these medical groups have their own rules about how many and how big and whether you're accepting new patients or not. And part of this is based on the type of practice, and it's worth noting that our community health centers, of course, do a big piece of this Medi-Cal work. And actually yesterday the CPCA conference was ending in Long Beach. And really, if you look at that room, a lot of Latinos and physicians and clinicians who largely are serving the Medi-Cal population. And we have a separate report on this on our website. If you go and look today, was a presentation we did for the board. Sergio's on the board of the California Healthcare Foundation. We did a presentation on the federally qualified health center infrastructure. And today, they are serving a little over 60% of the primary care services for the Medi-Cal population in these community clinics. And they're really, really stretched for resources, right? Which is really the theme of yesterday's meeting. And then provider participation in Medi-Cal also varies by specialty. As you can see, OBGYN and PEDS. But look at what happens when you move into psychiatry. And if you look now at how we're going to be reimbursing for care and what the financial changes are and what we want to see as an outcome, and when David Hayes and Batista and I were talking about this over dinner last night, a significant part of what we are dealing with in keeping the most ill people who also happen to have mental illnesses together, we do not have anywhere near the workforce in psychiatry and in substance use disorder and addiction that we need to meet the needs of the Medi-Cal population broadly, let alone the Latino population. And that's not a conversation we've largely had as a Latino physician group. I mean, this is work that Sergio has spent his whole career doing, and actually has an innovative program at UC Davis to train primary care physicians in psychiatry that I hope he'll talk about in a minute. But this is an enormous gap for Medi-Cal. And so for families who suddenly have an insurance card and you have issues with depression, or you have a child with a thought disorder, or you have a sibling, this is a significant gap in terms of cultural competency, in terms of language, in terms of really our workforce gaps that we as a community really ought to address. And I think the rest of these are pretty self-evident. Jose this morning mentioned that we have these geographic variations, and this is a slide that simply shows primary care physician participation in Medi-Cal by region. And you can see it really, there are very, very wide gaps in terms of participation in terms of region. Again, who's responsible for making sure that we have geographic variation that actually meets the size of the population? Answer is no single entity, right? It's simply market forces, market broadly defined. So what wide variations? And I spent a lot of time on these slides. This is one that is incredibly striking, right? The federally recommended number of FTEs per 100,000 people is 70. And the number of primary care physicians in Medi-Cal per 100,000 is 42. And Latinos make up the disproportionate number of Medi-Cal enrollees. So that's the access problem we have, right? That's why the work of the survey and really documenting the fact that we're still at a 5% physician participation relative to everything. So we've expanded Medi-Cal. What have we done about access? Right, and so this is just a very stark data point. And this is the enrollment growth. Back in 2013, we had about 7 million people in Medi-Cal, and today we have a little over 13 million people in Medi-Cal in the state. And of course, this is the story, Medi-Cal enrollee by race and ethnicity, and there you see Latinos represent about 60% of that population. So, and of course, this shouldn't surprise us either in terms of language spoken, as well as this piece to me really, and I'll stop here, the health inequities for Medi-Cal enrollees are quite stark, both in self-reported and really if you look at almost any indice, this is true with of course the exception of healthy babies, which we continue to have very healthy babies. What happens to them after that is another conversation, but I think the other, and I'll stop here, I really want to get a little bit more conversation going, but one other comment I would make, I was at a CHA meeting, California Hospital Association meeting the other day, and one of the things they're very concerned about is, well, we insured all these people, everybody's got a health insurance card, why is emergency utilization continuing to be very high? And in fact, the hospitals are having emergency room go on diversions at very high rates. And there was a very interesting conversation that ensued about, well, everybody's got insurance. Why don't they just go to a primary care doctor or an urgent care center? Why are they still in the emergency rooms? Well, access, just because you have an insurance card does not mean we solve the access problem. Never mind the fact that emergency rooms are open 24/7, Monday through Monday, 7 days a week. And so the notion that we've created access that is different from where people used to get access really is not the case. So with that, I want to stop. I do think the conversation I'd like us to go into, although I certainly want to open it up to anything that's on your mind. But one thing that really does sit with me hard is, how is it that we still only have 5% of the Latino physician participation? What are the systematic, the policy, why is it that we've not been able to break through a 5% participation? All of you have done it. You've climbed a lattice that many of us have worked on over the years in different capacities. You've had some mentorship. You've maybe had somebody that really helped you when you were in high school, or you had some counselor, or there was some touch that allowed us to break through in this room. But really to understand what are the systematic barriers that have us still at 5%, who's accountable for that, how do we hold them accountable, how do we speak as a one voice to begin to hold ourselves accountable for changing those systemic, and some of this is of course institutional racism, and we could talk about that. But to me, that's the most compelling thing. It is very different. We are in the legislature. We are well represented. You have all made it through. What would it take for us to break through a 5% rate? I mean, I think that the survey really compels us to think about that, and the real reason to think about that is access, and whether it's primary care or whether it's behavioral health, we really have not and will not meet the access gaps. Never mind retirement. We didn't even talk about burnout. That was a whole other theme, right? And it's important to this community because as Latino leaders, we get asked to do all kinds of things, right? Do mentorship, do work redesign, recruit, train, right? We wear many, many hats as we try to open up these doors and structural barriers. And so the conversation we want to have this morning is, why 5%? What can we, LPOC, and we collectively do for that? So let me open it up to questions, thoughts, observations. Again, anything that you heard today that you didn't already know, any ahas? Yes?
Yes, I do have a question. You talked about the leadership in the legislature, et cetera, but what's happening in the halls of academia? Because those are the people on the admissions committee.
Yeah.
Those are the people who promote or not our young residents to be, et cetera. So
So
we
it's-
see them after the residents.
It's a great question. So let me, did I go
How
up?
many numbers there?
Did I go out? Hello? Hello?
You have it like
I think it's out. Can you hear me?
that.
So I'm going to let our academic leaders come in on that, but I do want to make one observation about our legislature. And I'm not singling anyone out, but my concern about the legislature is this notion that we expanded.
Give you this one. And we are
Okay,
going
here we go.
to give this one.
How about that? My concern about the legislature is that we expanded Medi-Cal. Yeah, let me take this one off. Yeah.
Thank you.
Okay. Conversation that our leadership